Okay, so my name is Dr. Shahnaz Hassan. I'm a consultant psychiatrist with a special interest in ADHD and lifestyle interventions for ADHD, but also mental health in general. My interest in lifestyle medicine started with my own journey. Approximately 10 years ago, I took up running. The reason being I wanted to improve my health and longevity. I come from a family where there's a high burden of lifestyle-related disease, and I thought I need to do something to prevent this. That snowballed, and I went on to run a number of marathons. And I thought, well, that wasn't enough. Let me try triathlons. So I also did two Ironman 140-mile triathlons. I got good enough at triathlon to qualify for the GB age group team and was very humbled to represent them earlier this year at the World Triathlon Championships in Spain. So that's a little bit about me. Today, I'm going to cover with you what is ADHD, the current treatment as recommended by NICE, which is the National Institute of Clinical Excellence, and that's what their guidelines are widely used by healthcare professionals in the country for a number of diseases. And we'll also cover the pillars of lifestyle medicine and how we can apply them to ADHD and also for our health as well. Now, I said ADHD symptoms because these interventions are not just applicable to those who have been diagnosed with ADHD, but many of us might be able to relate to the symptoms and find these interventions helpful for ourselves or people that we know. So, what is ADHD? ADHD is a neurodevelopmental condition, so that means it's to do with the development of the brain. Genetic and environmental factors have a part to play. So there's two key chemicals that we're looking at in ADHD, and that's dopamine and noradrenaline. These neurotransmitters are needed for the pathways involved in all the functions of our brain related to attention, focus, impulse control, planning, movement, and so on. We know that in ADHD, the levels of these chemicals are a bit lower, and that's the rationale behind treatment, and it is to replace dopamine and noradrenaline. So we use something called the DIVA to help us diagnose ADHD in adults. And these are the symptoms of inattention presented. We're looking for 6 out of 9 of these symptoms to be present in childhood and 4 out of 9 of these symptoms to be presented in adulthood. The DIVA makes suggestion as to what constitutes each of these symptoms. For example, with careless mistakes and attention to detail, it says easily bogged down by details, but also making careless mistakes. Looking at attention, it suggests things like becoming quickly bored, asking questions about things that have already been discussed. So it gives us good guidance to really explore these symptoms in depth. When we're looking at hyperactivity and impulsivity, these are the 9 symptoms that we're looking for. In childhood, again, we're looking for 6 out of 9 of the symptoms to be present, and in adulthood, we're looking for 4 out of 9. So, for example, if we're thinking about motor activity, we're looking at things like always being busy, stepping over boundaries, having too much energy. The DIVA also suggests what we should look for in childhood, and examples of that are being excessively active at school, always on the go, also busy at home. So these are the areas that we explore when we're looking at the ADHD symptoms specifically. And if we get those cut-off numbers of symptoms, we can consider that an ADHD diagnosis might be present. Key things that we need to look for when making this diagnosis are that the onset of symptoms needs to be before 12 years of age. So when working with adults, we really want a collateral history from someone that knew them as a child, so a primary caregiver, and if not, a sibling or a very close friend. The symptoms, because they are neurodevelopmental and to do with how the brain has formed, are lifelong and persistent. But that doesn't mean that they can't be managed to a level that they're not problematic in someone's life. Now, another key thing to look for is there has to be significant impairment in 2 major life domains. The domains suggested for adults are work or education, secondly, social contacts, third, self-confidence or image. Mental health comes into that domain a lot. 4 free time or hobbies, and 5 relationships or family. Now, the same applies for children, but we look for presentation across multiple settings, for example, school, home, and social activities. Again, the DIVA gives us suggestions of what kind of things to look for in adulthood and also in childhood. So, for example, with work, it can be things like difficulty doing homework in children or not completing their education. And for adults, it can be being in multiple jobs, not achieving at work at the level that they perhaps feel they should be. And earlier I mentioned that this criteria can help suggest a diagnosis of ADHD. The reason being is we need to make sure that there isn't anything else going on. So when doing an assessment, we need to take a really detailed mental health history, which includes, asking right from birth up until the present life, and also a medical history. So the NICE guidance, first line treatment for ADHD is environmental modifications. Examples they suggest are reducing distractions, having movement breaks, changing seating arrangements. The reason that these are first line is because they are personal to each person and it empowers self-management. This is massively important in ADHD because no two brains are alike, and someone else's symptoms are going to be very different to another person, and what works for someone is going to be very different to what works for someone else. So there are no general recommendations on what modification should take place. This needs to be a personalized discussion with the person and their employer or the school, for example. If environmental modifications leave significant impairment in at least one domain, then we can consider medications. First-line medications for ADHD are stimulants. So the ones we use in adults are called lisdexamfetamine or methylphenidate. So these are the two main ones available. There's various doses and various preparations, but essentially what they do is increase the dopamine and noradrenaline levels in the brain within a few hours of taking them. If for any reason they're not tolerated or they're not suitable or contraindicated, then we look at the second line treatment, which is atomoxetine. This primarily works to increase noradrenaline, but also has impacts on dopamine. So the NICE guidance states about nutrition that healthcare professionals should stress the value of a balanced diet and good nutrition. It doesn't make any specific recommendations about what this constitutes. However, it does make 2 specific recommendations on what not to do. And that is to not advise elimination of artificial coloring and additives from food, and also to not recommend omega-3 fatty acids. This is because there's no robust evidence for these recommendations, as well as all other micronutrients such as magnesium, zinc, iron, and vitamin D. Now, all of them in research have had some positive findings, but also some studies have found nothing or negative findings. This is due to the difficulty in performing research when looking at specific nutrients. It's hard to isolate that is the cause of what we're seeing. So we call that confounding factors, and there's often a lot when we're looking at broad topics like this. So it makes it very difficult to draw any conclusions about any specific nutrients. There is, however, very good evidence for dietary patterns. A meta-analysis looking at over 8,000 cases found that what they described as a healthy diet, which was high in fruits, vegetables, whole grains, and phytochemicals, which are the pigments found in plants, and more so in brighter coloured fruit and vegetable, was linked to reduced ADHD symptoms. And what they described as the Western dietary pattern, which was high in processed foods, sugar, saturated fat, and red meat, was associated with an increase in ADHD symptoms. Furthermore, a large Korean study found that children who increased their intake of fruit and vegetables had an improvement in their ADHD symptoms. Now, again, just to stress that this isn't causal. It's very difficult to ascertain that this caused the ADHD symptoms or reduced the ADHD symptoms, but there has been a strong observation that the two are linked. So in summary, with nutrition, keep it simple. We don't want to create a over focus on or preoccupation on single nutrients, but aim for a gradual shift towards a more whole foods diet and minimize additives and ultra processed foods. I wanted to touch on protein because this is really popular at the moment. And I don't know about you, but I can't go into a supermarket without seeing high in protein labels shouting at me everywhere. The rationale for this in ADHD is that the dopamine and the noradrenaline and the chemicals needed in the brain are made of protein. So giving ourselves more protein will increase the synthesis of that. Protein is also released a lot slower, so can help stabilize blood sugars and prevent spikes in that, which we know can affect mood and anxiety, which is also implicated in ADHD. There has been a study that looked at prioritizing having protein in your breakfast, which reduces ADHD symptoms over the day. But overall, there is no recommendation to increase protein beyond daily recommendations. The benefits of having protein in your diet are usually seen as part of whole dietary interventions. And again, the evidence in this area is very limited. There is a link between ADHD and obesity. A meta-analysis of 42 studies found that those with ADHD were 1.55 times more likely to experience obesity. This risk was not present in those that were taking ADHD medication. So why is this? The chemical dopamine we discussed earlier is involved in our reward pathways. So when we do something that makes us feel good, dopamine is released, like enjoying a slice of cake. However, in ADHD, that reward mechanism is blunted due to lower dopamine and increased stimulus is needed. So that may lead to overconsumption to create the same effect. The symptom of impulsivity itself can also make regulating eating patterns hard. And difficulty with planning and organization can also make it difficult to make sure you have balanced meals available or that you're able to prepare these. So what can we do to help with this? As we know, we've discussed medication. Also, having regular small meals can help release regular amounts of dopamine and prevent crashes, and therefore the need to increase it by over consuming. Having healthier options available obviously requires some planning, but that's something that you can support your clients with to try and make sure that when they go shopping, that they look at their trolley and they have a good amount of ideally half of whole fruits and vegetables. As with anything, and I'm going to touch on this a lot in this presentation, is avoiding the all or nothing approach. This comes down to setting realistic expectations. We live in a society now where we want things to be done quickly, we want quick fixes, but with managing obesity and weight loss, the journey is gradual, and doing it in a more controlled, gradual way is going to create more sustainable results than going for quick extreme diet changes. Exercise can help with weight loss and regulate appetite, but as part of a balanced diet. And I would not recommend anybody utilize exercise with a focus of losing weight, as it can breed an unhealthy relationship with exercise and it can become a chore and something that you don't want to do. So we know that 25 to 65% of people with ADHD have disruption to their sleep-wake cycle. We call that a circadian rhythm. That's a Latin term. Dian means day and circa means around the clock. They tend to genetically be night owls, so they're better in the evenings and a bit slower in the mornings. The reason for that is because the hormone melatonin, which signals our body that it's time to sleep, is delayed. So that's what I mean by sleep-wake cycle disruption. So their melatonin is released a bit later than people without ADHD. So the advice for sleep hygiene that is generally recommended to all patients who are experiencing difficulties with sleep is very applicable to those with ADHD. Now, to go through some of the sleep hygiene methods, I've got a short quiz for you here. So I'm just going to give you a minute to read through these and just jot down or have a think about what the answers might be, and then I'll go through them with you. Okay, so hopefully you've all had a minute to just have a think about some of these things. So the first one, naps. These can be beneficial to improve waking alertness and combat daytime sleepiness, but they should be avoided if this is impacting on your nighttime sleep. So if you're not sleeping well at night and you're nodding off in the day, you need to cut out the naps in the day and really try to persevere to get to sleep at night, even if that means you have to go to sleep a bit earlier, because nighttime sleep is long and you go through all the proper stages of sleep, which is really essential for our memory and our well-being. Now, to help you to understand the role of caffeine, I'm just going to explain a bit about how this all works. I know some of you might be hoping that I'm saying that that is not true and you can have a cup of coffee in the morning. Now, you can have a cup of coffee in the morning, but what I would recommend is delaying it until you feel fully awake. So what happens when we are awake during the day? Our body cells are just ticking over, doing lots of things, keeping us alert and functioning. And they're making this product called adenosine. Adenosine creates a pressure to sleep. So it builds up over the day, and most people after about 12 to 15 hours start to feel sleepy, and then the sleep process will kick in. Now, when you go to sleep, your body starts clearing out that adenosine. If you wake up to an alarm, or you wake up feeling a bit groggy, or you haven't had a full night's sleep, then some of that adenosine might be floating around in the morning and it's making you still feel sleepy. If you have a cup of coffee or caffeine, it blocks the adenosine from working. So it creates an instant feeling of alertness, or within, half an hour or so. But that adenosine is still floating around. When the caffeine wears off, the adenosine starts to act again, and then you might experience a caffeine crash. And you will then reach for another cup of coffee, and you enter the cycle of not clearing out the sleepiness hormone, which can obviously affect your sleep. So, yes, it's fine to have caffeine, but try to get out of bed in the morning, get some light in your eyes, get some movement going, and feel a bit more alert before you reach for that cup of coffee. Now, alcohol is a sedative. It directly knocks you out by acting on those receptors that do that, similar to a lot of drugs we prescribe for sedation. It does not in any way induce the natural sleep process that I've spoken about. And it inhibits our sleep, our dream stage of sleep. And that's an important part of sleep for consolidating our memories. So long-term alcohol consumption can therefore cause difficulties with memory. Herbal remedies do have sedative properties. I am a fan of chamomile and I use it most evenings to help me to wind down and relax. So these can be recommended. Now, sleep trackers are not awfully accurate. When we measure or study sleep, we put electrodes on people's brains and look at brain activity. Sleep trackers look at things like movement overnight and your heart rate, or maybe the fancier ones look at blood pressure. So they don't give you a very good idea of what's actually going on in your brain. They can be helpful for some people. However, if your sleep tracker is making you more stressed about your sleep, then avoid using it. I had a gentleman who was doing very well with his ADHD medication, with his lifestyle. He was an ultra runner and very healthy. but he was preoccupied with his sleep tracker, and he'd bring it into his appointment and show me every time. And I told him to stop using it, and he didn't come and see me for a while. So that was good. Now, exercise can, so before I explain this, I just need to explain that one of the processes that happens before we go to sleep is our core body temperature drops. That's why sometimes you might have heard the advice to keep your bedroom cooler than the rest of the house. Now, exercise can increase your core body temperature and therefore inhibit the sleep onset process. Having a hot shower, on the other hand, can divert all the blood to your peripheries and lower your core body temperature. So that's why you might have heard the advice, having a bath in the evening or a soak in the evening can help. Now, if before bed or in the evening is the only time you can get exercise in, then do it. It's better to try and fit exercise in than not do it at all. So physical activity, in summary, it helps with ADHD because our increased heart rate, when we're doing it, increases the release of dopamine and noradrenaline. And it can be helpful for a number of ADHD symptoms, mental health symptoms, and physical health as well. Most of the research is in moderate to intense aerobic exercise. There is some benefits to strength training, but more research in this area is needed. In terms of how much you should do, this isn't any more for people with ADHD than the general population. So the Chief Medical Officer's recommendation is good enough, which is a combination of cardiovascular and strength training. So the development of information technology has been helpful for us in so many ways. We're more connected than ever before. We're able to sit here and do this webinar, and so many of you are able to join. So it has been brilliant. But it has also placed so much demand on our attention to the, more than our brains is able to cope with. Is this familiar to you, being on two devices at once? I've certainly done this many times. This rapid, brief, constant information is eroding our attention, not just those with ADHD. However, those with ADHD have a double dose of it because they have impaired executive control of their visual functions, which makes them more susceptible to distraction. Now, attention is not something that we're given or we're not necessarily all born with good attention. It's something that we need to work on. And, we do that from childhood. We start to train our attention. And we need to constantly train it to be able to maintain it. Otherwise, it will erode. These superficial and stimulating parcels of content that we're viewing on a daily basis doesn't require us to pay much attention and allows us to constantly switch, which is making it very difficult for us to train our attention. A large study in Nature looked at TV, gaming, and social media. They found that all forms increased ADHD symptoms through the mechanism of increasing impulsivity. And they all caused poorer working memory. And that explained the increase in ADHD symptoms for TV and video game use. They all impaired response inhibition. So that's when you're asked to do a task, for example, where you have to press a button when there's a red light and not press it when there's a green. And that was thought to partially explain the ADHD symptoms seen. There was no direct link to other computer use, for example, for work. So how can we improve this situation? The first thing we need to do is be completely honest with ourselves and actually track the amount of time we are using screens. If you think about it, we're exposed to screens a lot now. Many of us use computers for work, and then we use our phones and watch TVs in the evenings. So what I get patients to do, sometimes in their appointment when they give me a vague answer, is to get their phone out and check their screen time. Once we know what we're dealing with, we can target management. Most phones now have digital well-being apps that allow you to set limits on apps that you find that you're excessively using, such as social media, and will time out when you have used your allowance for the day. And maybe you can say to yourself, I only want to use my phone this many hours today. Turn off your notifications. How many of us have notifications that we don't need? I'm telling you, you don't need notifications from the BBC about the weather. Also think about email notifications. There's a big blur now in boundaries between our personal time and our work life. And there's this sense that we need to be constantly available. And, we could be doing something in our leisure time that's good for us, good for our mental health, and we get a notification about something from work and it takes us away. And vice versa. When you're trying to work, turn off your social media notifications so you can be as productive as you can in that time. We know that when we get distracted from the task at focus, it can take 2 or 3 minutes before we refocus on that task again. And if you think about the accumulation of that, it can then end up taking a lot longer to do something than it should have done. When you reach for your phone, or you want to press next when Netflix says next episode starting in 5 seconds, think about your why. Why are you doing this? Do you need, are you getting bored? Do you need a break? Do you need to find something else to do? And you might find that you're not picking up your phone as much. Try having no screen zones, for example, in your bedroom or at the dining table, or if you sit in the living room with your family in the evenings, try to make that a screen-free zone for mobile phones. The blue light in phones directly suppresses the sleep chemical melatonin, which induces the sleep process. This is why you might have sometimes heard the advice to avoid screens before bed. So if you're scrolling in bed, then your body is going to get confused and think that it's not time to sleep. The time that you can get back from this excessive screen use, you can use to do something meaningful, that hobby that you always wanted to do, take up reading or whatever you've been meaning to do. You could probably get that time back from managing your screen use. Now, you might have seen your friends, or you might have even done this yourself, going on a social media detox, saying, oh, I'm going to see you in a week, I'm not going to be contactable on Facebook. And that's good that they're thinking about their use. They're obviously concerned about it in some way. It's obviously affecting them in some way. But this, again, is an all or nothing approach. Now, while it might be good initially, what you really need to work on is making gradual changes that are sustainable over time. So mindfulness has moderate to strong benefits for improving ADHD symptoms on clinician-rated scale. If you think about the practice of mindfulness, what is it that you're doing? You're training your attention. Now, mindfulness doesn't have to be done like it is in this picture, sitting there focusing on, just your inner thoughts. There's lots of different types of mindfulness that you can explore. You can use your breathing for focus, for example. Body scanning is thinking about each part of your body and how you're feeling and tuning into it. For example, right now you can think about how your chair is taking your weight, how your feet are placed on the ground, how your shoulders are set. You can also do mindfulness outside in nature, which I really enjoy, and that's sort of taking in the sounds of nature, your footsteps, your breathing. And again, with anything, you need to start short and build. Having a goal of saying you want to do 30 minutes of mindfulness and meditation is actually really hard. So starting with 30 seconds a day, if that's all you can do, is good enough. And then you can build from there. You might think that this is an odd lifestyle intervention, but having purpose and identity, whether that be our hobbies or work, is a key component of good mental health, as it creates a sense of belonging. Shaping our identity requires small steps along the way, which is where goal setting comes into play. These can be daily or long term. With patients that are really, struggling to get any sort of direction, I'm a real big fan of them doing 2 or 3 daily goals. That can be as small as I'm going to make sure I make my bed today, or I'm going to make sure I have a piece of fruit with my lunch. But just achieving those goals can be powerful and enforcing to them that they can achieve, and then they can build from there. In healthcare, we use the SMART concept. That stands for specific, measurable, achievable, realistic, and time-specific. Goals can be a positive action or a negative action, that is, adding in something or taking something away. It's better to, or easier sometimes, to add things in or replace things. A smart positive goal, for example, would be I want to add in 2 fruits a day to my diet for the next 2 weeks. Now, this seems very small, but if you're looking at doing a dietary shift, this is a good place to start. And then once you've achieved that, you can consider how you could increase that to the recommended intake of fruit and vegetables. A smart negative goal could be I want to reduce my soft drink consumption from 5 a week to 3 a week. When looking at something like this, I normally suggest replacing it with something. So that could be a sugar-free soft drink or a squash or something else that you might be doing in that time. And that makes it a bit more achievable and a bit more sustainable. I often hear people a lot tell me that they don't have motivation. But this, like attention, is not something that we can expect. It's not something that we are given. Motivation comes with benefits reaped from being consistent at something. So this is me and my husband at our first 140-mile triathlon. This was a long journey for me. It was my start into triathlon. And did I feel motivated to train all the time? Of course not. But I was building my identity as a triathlete, which is something that I really wanted. And the more I showed up for myself, the more I enjoyed this and the more motivated I became. Now, don't get me wrong, there are still days that I don't feel motivated. But on those days, I try to remind myself of the bigger picture and do something. So I might not be able to do the session that I wanted to do, but if I do part of it, then I feel like I'm working towards my goals. Finally, it's really important to take a personalized approach. Don't advise specifics. Don't tell people you need to exercise, you need to eat this, and you need to eat that, because that's rarely effective. Work with the person to come up with the solutions or the ideas themselves. You can look, for example, you can just take a motivational interviewing approach, for example, where you look at the pros and the cons of specific changes. And these things take time. Often, when I ask patients on the spot what goals they have or what would they like to work on, they draw a blank and they don't know. So I tell them to think about it and come back to me at their next appointment. So yes, I don't have time is something that we can all relate to. Life is very busy and it's becoming increasingly so with all these demands placed on us. This is where we really need to look at priorities and also boundaries. We can't possibly do everything, and something needs to give. And sometimes that can be difficult, but ultimately, we need to sometimes make difficult choices for our own health. So some of you might have heard of this rock, pebble, and sand analogy. The rocks are the most important things in your life. For me, that's loved ones, relaxation time, being in good health, eating well. The pebbles are necessary, so that's things like work and taking care of your house. The sand is the small stuff that, is negligible whether it matters or not, such as material possessions, scrolling time. Now, if you look at these jars, if you fill the jar with sand first, then you can't fit in the most important things in your life. So perhaps take some time to reevaluate your priorities and where you can make change. One tip that I read in a book was time boxing. Now, this is something that you just need to do over a week or two, and that's literally jotting down what you're doing every hour for that week, and then going back and looking at that, and that will give you an honest view of how you're spending your time. And you can perhaps find where you're spending time on less important things and give it to important things. So these are my list of references, and I understand you'll be getting the slides of all the studies that I've mentioned. If you want to learn more about lifestyle medicine in general, I would recommend the Redwell Digital Lifestyle course, where I got a lot of my knowledge from. And I'd like to thank you all for listening to me and your time today. And I think we will now have a Q&A. You're muted, Rohini.
I've only done about 90 webinars, so that was absolutely wonderful. Thank you so much. I felt like you gave so many practical tips without it feeling judgmental as well. And I think really explaining what exactly it is, obviously focusing on the adult side of the condition, that's your area. But I felt like, even just saying to people, don't tell them what to eat, but kind of just breaking it down and giving those practical and kind of smart oriented goals was super helpful. So out of curiosity, obviously, I know that you have a specialist interest in ADHD. What do you feel is the reason for this huge sort of surge in interest in ADHD, especially over the last 5 years or so? If you simply go onto TikTok, maybe something that I'll be doing less after this webinar, but if you go onto TikTok or Instagram and you type in ADHD, you'll be met with hundreds of thousands, if not millions, of recommendations, reels, videos. What is the reason for that? And why is there such a focus now as well on adult ADHD?
Yeah, so the exposure, as you mentioned, is increased. So there's more awareness being generated. So people are exploring ADHD a lot more. There is also an element of undiagnosed ADHD in children, which is now presenting in adults. ADHD is relatively new in terms of medicine field, and perhaps sort of 30 years ago it wasn't so much thought of as something that could be going on when there were difficulties, and people are now coming to understand that. There's also been a change in the diagnostic criteria, so it's a lot broader. So, for example, the onset of symptoms used to be before 7, which you can understand is very hard for an adult to ascertain that, and that's now changed to 12. And the number of symptoms we're looking at has also gone down from 6 in adults to 4. So there's more scope for diagnosis. There is also obviously a concern about overdiagnosis, and there is something that is being looked into. As I've mentioned at the start of this presentation, a lot of us could identify with the symptoms, but that doesn't necessarily mean we have the diagnosis of ADHD. There might be other things that we can do to help with those symptoms. There's also obviously variability in practice, as there is across medicine. And I unfortunately myself have seen assessments being done that aren't particularly thorough. The increased pressure has created, a pressure to get through the referrals rather than to do a longer assessment. So those are some of the reasons that we might be seeing more ADHD.
That's really helpful. Thank you. And are there particular points in someone's life in adulthood where they might be more likely to get a diagnosis, triggers, or events that might precipitate a diagnosis? And you might be seeing more of a resurgence or kind of extreme symptoms coming up.
Yeah, I see a lot of adult diagnosis in young adults when they go through the transition from living at home and school to then living independently or going to university. Some of that can be explained by maybe the skill set and not, needing to learn how to live independently, but some of it is also explained by ADHD, whereas before they had a lot of structure in place to support the ADHD symptoms, and that's now gone in the transition. I'm also seeing it a lot in perimenopause. There's a lot of overlap between ADHD symptoms and menopausal symptoms. And also when people go through transitional changes in their life, like changing jobs, they might find that the symptoms become more apparent.
And how about stressful life events, for example, moving house or country or going through a divorce? Can stress itself be kind of can it impact people with ADHD differently in adulthood?
Yeah, I think obviously these kind of events would exacerbate any underlying ADHD symptoms, but if someone's going through a significant or acute life event, then I wouldn't make the diagnosis until they were back to some sort of baseline, because it's hard to say, are they struggling more because this stress is going on, which can, impact sleep and impact mental health, and that could present obviously as ADHD symptoms.
One question that's come up is one of the criticisms of lifestyle medicine is that it focuses more on the individual and not the system approach. How can social determinants of health and culture influence behavior change? And they've also said great presentation. So I think they're kind of wondering how can, social determinants of health and kind of wider societal culture influence.
Yeah, I think when it comes to lifestyle medicine, obviously as clinicians, that's a tool that we've got in our arsenal. But there is a lot of wider work. My husband does a lot of this work, actually changing the social determinants of health. And we know that, deprivation and, things are not equally accessible to all. So that is a massive part to play. We know ADHD is higher in deprived areas. And, we need government backing. We need societal change definitely to support everyone to lead healthier lifestyles. We need better access for everyone to whole foods, not just in more affluent areas, and better access to gyms and outdoor spaces. So that's massive. That's massively going to change things. I think with lifestyle medicine, we're all just doing our best as clinicians to support people. But yeah, you're completely right. It's a much bigger issue than that.
Definitely. Thank you for sharing that. And for everyone who's listening, I think many of you will have joined the fantastic webinar by Dr. Shahnaz's husband, Dr. Hussein Al-Zubaidi, and I know that he's speaking at our conference this year, the Nutrition and Lifestyle Medicine Conference, I believe in November. And the webinar is called Move It or Lose It, if you want to check it out in our members area. It was a fantastic webinar, so do go and have a look at that. Is there any evidence that people can develop ADHD as an adult due to excessive screen use, so nurture versus nature, or can it only apply to people that had it as a child as well?
Well, currently the diagnostic criteria suggests childhood. Because it's neurodevelopmental, we would expect the onset to be in childhood. Now, excessive screen use might cause a presentation of ADHD symptoms that maybe wasn't there for various other reasons, but if you explored further, spoke to parents or caregivers or looked at school reports, there would be some evidence of ADHD for it to be diagnosed as ADHD. But excessive screen use, as I've explained, is an area that's being researched, but it can cause what ADHD symptoms that we're seeing. But in order for the diagnosis to be made, we would expect it to be an inherent disorder, as in it would have started younger.
Thank you. With the obesity link, do you think there's any correlation with hunger and satiety? For example, could those with ADHD tend not to feel full and overeat, or do you feel that it's all about the reward system?
I don't actually know what the studies are on that, but a lot of the time, what my personal experience is talking to patients with it is they find it hard to control the impulsivity. So they enjoy the food, the cravings that they're getting, so they would just eat for that reason. And often, actually, when we give them medication, they do find that the impulsivity goes, and they're better able to regulate that symptom.
And I think anything that can improve the mind-body connection and kind of interoceptive awareness can really help as well. So kind of modalities like that can strengthen that, even yoga,
Yeah.
CBT, like all of these techniques can support that for sure in anyone that's struggling with hunger and fullness cues. So another great question. I've heard via a Tired but Wired course that naps can help file some of the busy and possibly excessive thoughts that will stop sleep at night. Is the advice therefore different for mainstream, or I guess neurotypical people compared to folks with ADHD?
Yeah, I mean, a lot of people with ADHD struggle to sleep because of the excessive thoughts and the anxiety and the overthinking. So often when we treat them with medication, that reduces, and therefore their sleep can start to improve. And sometimes we add in melatonin. But with naps, I'm for them if they are helping. But if you're having really disturbed sleep and that's affecting your life and you can't, do things you want to do, then I would try to focus primarily on getting a good nighttime sleep. But yeah, naps are fine, as I said, if it does help. But we need to ensure that we get that good full sleep cycle at night, because that's when we go to sleep. As we cycle through, we process everything that happened to the day, we consolidate, we learn, and our memories form. So if we're not getting that, then that's going to have a bigger impact in the longer term. And if we don't focus on that. So yes, we can have naps, but we need to prioritize nighttime sleep.
Yeah, I think that's really clear. And I liked all the tips around the circadian rhythm function and, getting some morning light or morning movement being really helpful. And there's one more question about the new weight loss injections. So I guess GLP-1s. Has there been anything studied around that and impulsivity to eat?
I don't know. I'm not sure.
I know that with binge eating, that it's been shown to have a benefit for that, and obviously there is a bit of an overlap with binge eating and
Yeah.
ADHD symptoms as well. So potentially yes, in terms of helping with that, but I guess it's going to have a lot of individual variation, and I'm not aware of the research in a lot of detail, but certainly for people with binge eating.
Yeah, I mean, I understand this mechanism of action is to cause primarily appetite loss, so therefore you could argue that the impulses may not be there, but I don't actually know if there's been any research into it, or what the research is on that.
Wonderful. So there was a slide saying avoid the all or nothing approach. Could you expand on that a little bit more, please, and maybe how it applies to ADHD?
Yeah, so a lot of people with ADHD, and maybe some of us, maybe, with a lot of, when you see these diets that have come out, like the 500, I don't know, all these various things, they're very extreme approaches. So often my patients will have this extreme goal that they want to achieve, and it's either that or they're not going to do anything towards it. So but what I mean by all or nothing is don't go for an extreme. Have a process where you build towards it. So this is where I spoke about, setting the small goal of, say you wanted to shift your diet to a more whole foods diet, just adding in a couple of fruits for a couple of weeks, and then adding in this, and then adding in that. And then gradually you'll get to the diet that you hope to achieve. But if you say from day one, I'm going to cut out all this sugar, I'm not going to eat any chocolate, I'm just going to have fruits for snacks, it's not going to be sustainable. So that's what I mean by all or nothing.
Definitely. And I guess kind of binary thinking of, oh, I'm gonna, try like you to be kind of a GB athlete. I'm gonna train for 4 hours every day. I think going from baseline, that's going to be incredibly difficult for probably most of us sitting here watching it, but it's something you've built up over time and probably
Yeah,
will active. So it can be applied to everything, can't it? Kind of like that.
exactly.
All or nothing. I've had one biscuit and might as well have the whole packet. And I see that with
Yeah.
clients a lot for sure. And perhaps something that is discussed quite a lot is neurodivergence as a kind of broader spectrum, and some positive traits that can also result from various kind of elements of being neurodivergent. And are there traits that you see that could potentially be harnessed in those with ADHD? Are there any positive elements? Obviously, I'm not dismissing the struggles that people go through when they have ADHD, but are there any things that could be used in such a way that might be able to support them, or that can be kind of strong points for them?
Yeah. So neurodiversity is a huge spectrum, and we're all on that spectrum somewhere. And I say to all my patients, I don't really like the term disorder, because they're not disordered. This is just how their brain is working. And we need to find out what works for them and what doesn't work for them. It's just like with everything, some of us are good at something and not other things. So we adapt and we tend to focus on the things we're good at. So, a lot of people with ADHD, for example, they can hyper focus and they can get really into things that they're interested in, and produce amazing artworks, or do really well at their jobs. So it's finding and channeling the strengths for them, and supporting the things that are challenging.
Yeah, I think that's a really good point around kind of, yeah, a lot of people with ADHD being drawn to kind of creative pursuits, or being able to hyper focus and have specific passions and interests. And how about overlapping, conditions or comorbidities with ADHD? Is there anything to be aware of, that if you have the condition of ADHD, that you might be more likely to develop or be diagnosed with? We talked about obesity, but are there other
Yeah.
areas of even neurodivergence that you'd want to highlight to practitioners who are listening?
Yeah, so anxiety disorders are a really big one, and a lot of anxiety disorders that we were seeing on now actually ADHD. It was the ADHD is driving the anxiety. So, a number of patients, I've got them on ADHD medications and got them off, the SSRIs or the antidepressants that were managing the anxiety. They say, oh, it's not working because the reason for the anxiety is not being treated. So that's a really common overlap that we see. Also with mood, I think a lot of people with ADHD, because of the excessive thoughts in their brains, they can feel overwhelmed, they feel like they need to do lots of stuff, and that can have consequences on their mental health. So we can see a lot of comorbid depression. There's also a lot of, due to the impulsivity symptoms mainly, we see a lot of substance use, alcohol use, and some people say that they use that to self-medicate. So treating them for ADHD can be a way to helping them to stop using substances or cutting down on alcohol use. So those are the main things we look out for. There is obviously there is a lot of overlap between autism and ADHD as well. And some years ago you couldn't be diagnosed with both, and now you can. So people with autism are now also seeking ADHD diagnosis if they feel they have symptoms. So that is also another increase in the diagnosis rates that we're seeing.
Amazing. Gosh, the question was so many wonderful questions. I think everyone's really loved the talk, so that's great. What would you think would be the best advice to focus on for patients in general practice who are awaiting diagnosis presenting with symptoms of ADHD?
Yeah, so I say to all my patients, I massively stress the importance of non-medical intervention for ADHD. It's first line by NICE, but unfortunately, we don't have any services out there that are specifically tailored to this. So I think this is again going back to wider public health. It is really, I think it's something urgent that we need to look at supporting patients into non-medical aspects. So there is something called ADHD coaching. So you can get a coach who's specifically trained in managing ADHD symptoms, because the non-medical management of ADHD is the crux of it really, and it's the thing that's underlying that is going to help with long-term stability, and then the medication come in and add on and help. So I think it's important to try and explore how you can support your ADHD without medications while you're waiting for a possible assessment for treatment. Whether you have the diagnosis or whether you have symptoms, there's lots of stuff that you can look into. There's lots of resources online as well. The Royal College of Psychiatrists has booklets, and the ADHD Foundation has guidance on lots of things that you can try to help manage your ADHD.
Thank you. That's really helpful. And of course, things like substance addiction, to be able to kind of be referred to the right services, you kind of pointed that out as well, like that increase in alcohol use or substance use. So being referred to stopping smoking services or other services that could be really supportive whilst waiting for a diagnosis. Um, Thank you for the talk. For diagnoses in adults, are clinicians looking for symptoms in both adulthood and childhood? As in, if there aren't many signs from childhood, but more in adulthood, is it difficult to diagnose?
Yes, we do look at both. It can make it harder to diagnose, but it doesn't mean we can't diagnose it. We just do our best to get as much childhood evidence as we can. It's not always possible. I've had patients as old as 80 who haven't got anyone that knew them as a child. And I have made the diagnosis based primarily on what they can recall and their symptoms in adulthood. So we've got to be pragmatic, really. If we can't get that history or they can't remember, often people can't remember. And even when we ask parents, they can't remember what their adult child was like when they were like 7 or 8 years old. It's a long time that's lapsed. Sometimes we try to get school reports that can give us a really good insight as to whether there was any symptoms in childhood.
Well, that's really interesting. Great, thank you so much. Is there anything else that you think is important for? I've just launched a little poll to get everyone's feedback as well, so please do answer that,
Yeah.
everyone. Is there anything else that you'd want to add that you think is really important? So many people join here from general practice and who are seeing so many people searching for an ADHD diagnosis, and I guess more awareness is fantastic. But is there anything that you'd want them to know, or health professionals to know about ADHD?
Yeah, I mean, I think because we're seeing so many symptoms and so many diagnoses, I think as with a lot of mental health, we need to really self-empower people. So we need to give them the tools, we need to give them the information, we need to give them the knowledge to be able to support these symptoms, because they go into all aspects of their life. And yes, medication has a role to play, and I prescribe a lot of medication, but it's there. I do sometimes feel that there is a reliance on it, and some patients come to me thinking that it's going to be a magic bullet, and it isn't. So some of the pressure to get the diagnosis and get through the system and is for the medication, but there's lots of stuff that we can do before that point to try and help.
Yeah, and I love that. It's kind of just using all those 6 lifestyle pillars and getting kind of just even moving the needle in some of those areas. It doesn't need to
Yeah,
be nothing, but just simply adding in rather than subtracting, kind of making shifts towards more movement, more sleep, better
exactly.
quality relationships. All of that can be really supportive for ADHD. So thank you so much. It's been a fantastic webinar. I've learned so much. I feel like this term is being used so much, but so few of us really know what the diagnostic criteria is. And I think you spelt it out so clearly what the condition is and what the kind of a plan of action would look like. So where can everyone keep in touch with you, Dr. Shahnaz? Like where do you practice? Is there any are there any other ways that we can kind of follow your work?
Yeah, I'm on LinkedIn, just Shahnaz Hassan, and I practice at the Oxford ADHD Centre. So I see adults there for diagnosis, titration, and follow-ups. So you can come to the ADHD Centre if you feel like you wanted to explore that. They also specialise in autism there as well.
Okay. Fantastic. And yeah, that's super helpful. So do go and check out those resources and check out Plant-Based Health Professionals UK. Obviously, we've got a 21-day challenge to help people shift towards eating more plants, and loads of resources on lifestyle medicine as well. So thank you everyone for joining, and see you at the next webinar on the 6th of August, all about raising healthy children on plant-based diet. So thank you so much again for a wonderful webinar. As you can see, loads of amazing comments. Excellent.
Thank you, everybody. That's really kind. Thank you.
I think everyone's just loved it. So, and I know we'll have lots of people watching on catch up as well. So thanks again for your time and for your expertise.
Thank you.
Take care, everyone. Good night.
Bye-bye. Thanks, everybody.